Hi, good day. My name is Dr. Terry Chambers, and this is this week's blog, and I'm going to talk about hot flashes and why it is that as I get older and my period changes, I'm feeling hot and cold and having all these hormonal issues. And is there a natural way to figure it out and to treat it so that I don't have to be placed on a synthetic estrogen or hormone replacement that has been known to cause all kinds of pretty serious complications? There are natural ways to treat hot flashes. So I'm going to talk a little bit about what causes them and about some of the natural treatments that are available. First of all, as we age, obviously females, is that we go through menopause, and during that time our hormones change. Progesterone is used to help us with the second stage of our menstrual cycle. So as our progesterone levels decrease or change, we start having hormonal changes which lead to hot flashes, burning up, and things along that path. A lot of people may have heard of a cream called a cream that they use that has wild yam in it, which has a progesterone type cream that they rub on their body. And that's a very dangerous way to replace natural progesterone or estrogen levels in your body because you can't control the dosage. The way in which you treat a lot of hot flashes is doing progesterone drops, which are made from wild yam, and you place them on your tongue and use so many based on where your levels are. So you have to test your levels. And if you go on the drops over a couple months, it should regulate the hot flashes that you're having. The nice thing about the natural homeopathic replacement drops is that they're very safe. They are not known to have any side effects, and they work. Now, a lot of women are not quite in the menopause region. They're what we refer to in the middle, or they're young women who are having cycles that'll go 3 cycles a month or 1 cycle every 3 months. And they'll notice that during these times when their period is messed up, that their hormones are messed up as well. And you can ask any husband and they can give you the whole story, that a perfectly normal, beautiful person will, for unknown reasons, just have these outbursts of anger or frustration. And it gives new meaning to the word axe murder. So what I'm trying to say is that also your progesterone levels are very important, because what it does is when you're getting ready to menstruate, and you drop the egg, so to speak, to be implanted into the estrogen that's laid the foundation around the 12th or 15th day. As if you're not pregnant, then the progesterone will clean that mess up, so to speak. If for some reason the egg is dropping too soon or your period is messed up, you'll have spikes of progesterone 2 or 3 times a month. And it's during these spikes that you'll be emotionally have all kinds of issues, lead to depression, weight gain, and on and on. So progesterone drops also are very effective during those times, but they have to be done a certain way. They're 2 weeks on, 2 weeks off, but you have to understand the formulary. Now, how do you find out what the formulary is? You have to go through testing. And we do what's known as the saliva test that checks and see where your hormone levels. And the reason you do saliva versus blood, because the hormones in the blood are in the protein-based stable form. When you check saliva, they're free fragmented and they're still active during the day. DHEA is a good example. It has a 30-minute half-life, so every 30 minutes it disappears. So if you check the saliva 3 times or 4 times a day, you're going to know what those levels are. But if you check the protein-based sulfur DHEA, it's the stable form, and it tells you what was accumulated during the day but not how it's been utilized. So running the right test, knowing which test to run, what to check for, gives you insights on how to treat these conditions and have really decent results in a relatively short, inexpensive time. And here's the key though. Hormone replacements is so controversial. So we like to use homeopathic replacement because it's natural and you control the dose by using the drops. Be careful if you try to self-administrate this stuff. It can really mess you up. Not only can it mess you up, it can mess up your loved ones. Because when you put creams that absorb into your body and then you have body-to-body contact with someone when the cream's not totally absorbed, that person also gets absorption ratios. I've seen progesterone levels which should be 200 or 300 at 2,000 and above because the administration of the cream was inappropriate or unable to be regulated. Anyway, this is this week's blog. You can always check my website at chamberschiropractic.com, or you can give me a call and we can always chat or make an appointment. And my phone number is 304-263-4927. And it's nice seeing you this week, and I'll talk to you next week. Bye.